Hi, welcome everyone. It's 11 o'clock, so we're going to go ahead and get started. I will start by introducing myself. My name is Kirsten Weeks, and I'm the Vice President for Global Health at DAI, and I am based in North Carolina, so excited to be joining you all virtually this afternoon and morning, depending on where you're joining us around the world. And I'm just going to ask the participants to go ahead and introduce themselves. Lydia, do you want to introduce yourself first?
Yeah, thanks, Kirsten. I'm Lydia Poole. I work at the Centre for Disaster Protection, which is an independent organisation based in the UK, specialising in disaster risk financing. We are also part of the DAI family. We're managed by DAI. They're our managing agent. And I lead the evidence and research programme at the Centre. Thank you.
Thanks. Omer, I'm going to ask you to introduce yourself.
Thanks, Kirsten. My name is Omer Njajou. I am an epidemiologist. I live in Cameroon. And good afternoon or good morning from wherever you are joining. So I'm an epidemiologist, and I've been the country coordinator for the Tackling Deadly Disease Project in Africa, which is basically fighting pandemics and epidemics. So I also the senior technical lead in charge of international health regulation and the One Health. So good to meet you all.
Thanks. And last but not least, most certainly, Ric, over to you.
Good afternoon, everybody. Ric Goodman. I work with DAI in the UK, where I'm the director leading on social protection. I spend most of my time these days working on the FCDO funded social protection technical advice, technical assistance advice and resources facility called STAR, which focuses on social transfers in fragile states. So that spans humanitarian cash transfers and government-led social protection systems, and of course the merger between the two.
Thanks, Ric. So I'm just going to ask the group collectively, but maybe we'll start with Omer. What does effective risk management look like to you from your perspective? Oh, wait, Omer, you're on mute.
Sorry about that. So I would say that effective risk management for me means to develop a plan, plan your management effectively to allocate resources. It can be financial resources, it can be human resources, and you have to do that adequately through the government and also through all the systems. So for me, I think one thing that we want to do is first to plan adequately, like attribute resources adequately, and finally build a health system resilient. For me, I'm on the health side, so I will talk more about health system, building health system resilience. Thank you.
Thanks. And Lydia, just speaking on financing, and I know that you work on helping countries prepare, how does it work in terms of linking financing and preparation?
Yeah, I think there's a lot of synergy and overlap with what Omer has just been describing in terms of the emphasis on planning. And I think from our perspective at the Centre, we tend to take as our starting point trying to think through what is the outcome or the future which you want to avoid. So what do you consider as a government or as an international community to be an intolerable outcome, and then trying to work back from there and thinking through what you would need to put in place in order to avoid that. So that might be in terms of how you would think about reducing or preventing the impacts of shocks on welfare or on economic and social development, or on the opportunity costs that you might incur if you were to divert spending from something which you had planned for something else, which you might think is valuable. And disaster risk financing, I think, is quite a powerful tool potentially for that, both on the financing and the planning side. So we tend to think about DRF as making sure that you put in place financing so it's available at the right time to have the most significant impact in sort of trying to avoid those intolerable outcomes. But it's also about creating incentives and the discipline to plan. So you think through what resources you'll need, and particularly at what particular moment in the arc of a response, or even before a response, what you might need to do to prepare and even prevent further up the line. And then also it helps you to think through who is responsible for what, and to clarify roles and responsibilities. So I think for us, it's both the financing, but also the plan, as Omer emphasised.
Great. Ric, I just want to turn it over to you for a second, just kind of expand on that process of planning and financing and what risk management means to you.
Thanks, Kirsten. So, I mean, the short kind of more textbook answer is that where kind of risks are identified, assessed for their probability and potential impact, and measures are put in place to reduce that likelihood and or reduce the impact, both reduce your exposure to that risk. I think the key in terms of disaster preparedness is that there needs to be a plan put in place before the event occurs. Stating the obvious, but it's not often done, and that is managed as a continuous, actively managed process, and individuals, institutions, organizations are assigned responsibility and held accountable for their for their tasks, either to reduce the probability or to reduce the impact. And that last part is where we reality starts to drift from the textbook, that it's often not the case that is that the accountability measures are there. So having the active management and having the plan laid out as clearly as possible for what is going to happen even when a disaster occurs is key to setting up a whole strategy to reduce risk. I'm sure we'll get into the more detail and the longer answer to that question in due course.
Yes, I want to just piggyback a little bit on the theme that you just raised around accountability, and maybe ask each of you, because you come from different sectors in terms of social protection, health, and sort of broader governance preparation, what does accountability look like from each of those sector perspectives? So maybe Lydia, starting with you, and then Omer, and then Ric.
I think accountability is it's really a hard one in disaster risk financing. It tends to have, up to this point, been a pretty top-down enterprise, and on the supply side, it's kind of a seller's market. So there aren't many incentives right now to build in accountability towards crisis-affected people. So that's something which you have to very intentionally set out to do. So that's something that we try to always encourage and promote in the advice that we give to people who are developing disaster risk financing solutions. But in all honesty, it's an area in which we're pretty far behind right now. And there are also some practical challenges in terms of how you would achieve that. So I think in order to hold an institution or a government to account on something, you have to understand what it is that's being provided and what good would look like and what your rights and entitlements are. So disaster risk financing is a pretty esoteric concept for a lot of people, including a lot of governments. So it's hard for them even to interrogate critically what they're being offered a lot of the time. And it's even harder for populations who might have very limited access to information about what risks they're exposed to, what the responsibilities and commitments of their governments are, and the nature of the products that those governments might have put in place. So I think there's a whole gamut of areas in which quite substantial investments would be needed before we can start to talk about having kind of routine and effective accountability measures in disaster risk financing. I think one positive sign that we've seen recently is that the Global Shield, which is bringing together some large institutional funds and a variety of different actors across the G7 and the V20 countries. They have a commitment to build accountability and inclusion of the views and perspectives of crisis-affected people in their country prioritization processes. So that has yet to come to fruition, but at least we're starting to see some positive signs in terms of a shift in the sector. But I think it's probably an area where we've got a lot to learn from other sectors.
Great. And Omer, I know on TDA, there were some challenges around accountability and wanting civil society to be engaged in that, but also not to be perceived as a threat in engaging with the government and perceived as a partner when it comes to health security and disaster preparedness and management. Could you talk a little bit about what accountability looks like and if it's shared between civil society and government, or you see it as one-sided?
Thank you. So I think, yes, for the project you mentioned, the Tackling Deadly Disease Africa program, the DAI program, we really had a big issue, a lot of problems starting to define what accountability is. For the government side, it was like the civil society was going to come and check them in and see whether they are living up to expectation, whether they are doing what they are saying. And it was difficult for the government, who owns and controls everything, to just allow people in the room to control them. And it was really difficult. So we had to try to build that trust between the government and the civil society, and telling them that they are not coming, just to check and see whether your scorecard is good, whether you're doing well or not, but you are going to work together so that they kind of bring the message back to the community. I would say that greater attention needs to be given to the developing procedures for financial management and procurement that can mobilize funds and equipment rapidly. So we need to do that while maintaining safeguards against corruption and diversion of funds. And that's what we saw with the COVID response there when we work with the civil society. So now, now where the civil society, if they come in as a gendarme, as a military or police, to just say, no, you didn't do this well, you did it well, that will not work. So what we tried to do to prevent that corruption, to prevent that diversion of funds, was to make the civil society now part of every meeting. So we had the meeting that the government sat on, and they were part of it as members, full members of that entity. So for us in health and with civil society, accountability meant more collaboration and coordination between all the sectors. And so in practice, it's not easy, but I think we're successful, particularly that we tested that with the COVID vaccine response, where we really could see that the civil society was holding the government accountable for things that they were supposed to do, by being, a player, not being there like a police. Thank you.
Thanks so much, Omer. And Ric, I'm going to ask you one of the first questions from the chat from our participants, because it builds upon this conversation. But how do we ensure that local or national organizations are empowered to manage risks, as well as be a part of that accountability at a local level?
Yeah, really interesting question, and also the from Ayuba and also the previous comment from Tatiana, similar thing. How do you ensure a kind of accountability in hard to reach areas, in conflict areas where the presence of the state is not very strong? Really, it's down to good programming design practice as development partners, to ensure that there is adequate participation, that it's not a top-down process as far as possible, that that their civil society has a role in the design, the implementation, the validation, monitoring at all stages of program delivery. And at the point of a disaster response, whether it's protracted or a sudden onset response, those issues are amplified. The adequacy of targeting, of efficiency of delivery systems, and so on, become so much more problematic at the time of a crisis. So, ensuring adequate preparation, good participation, all the systems are in place ex ante in preparation. Of course, what Ayuba's comment about responsibility of private sector, I would also include individuals, communities, populations that we should be accountable to, also have a role, and should have a strong role in the design and feedback of the implementation of programs. Private sector, for example, in delivery of benefits, whether it's cash or in kind, and more general private sector actors in food systems, in cash delivery systems, have a business interest in continuity. They also have their own internal risk management and sustainability plans that they need. It's in their own interest, as well as the interests of aid delivery, to have for them to be on top of their own risk management plans.
Thanks. I want to shift the conversation a little bit to talk about something that came up a little bit earlier around recurrent versus sort of unexpected disasters. And I think when I think about COVID, for example, and the health space where I'm more comfortable working, in the health space, we expect to see Ebola every few years as a disaster. And when it happens in the places where it's expected to happen, there are systems in place, like the DRC has done a good job of responding to it. But when it happens in unexpected places, like Guinea and Sierra Leone, and Liberia the last time, or something like COVID that was unexpected, what are the different things we need in terms of being prepared for recurrent versus unexpected? And then how do we manage that risk response in recurrent or unexpected, and not limited to health, like it could be natural hazards or conflict, but kind of are there differences between recurring and unexpected disasters? And maybe I'll ask Lydia, you to answer it first.
This is a really tricky question. So we tended to, you can talk about risks which can be kind of forecast and modeled on a statistical basis, but we tend to, and for those you can put in place relatively detailed plans, and you can figure out roughly what to expect and what it would make sense to put in place for those things on a kind of statistically valid basis. Then there are a bunch of things which you could probably anticipate are quite likely to happen, which you're maybe not able to model, but you've got a pretty good guess that those things are likely to happen. So you might expect, for example, that if you're hosting a refugee population from another country, they're probably going to be there next year and the year after that. And so you probably will need to plan for that. And then there are things which are really hard to anticipate, and probably a lot of conflict would fall into that kind of category. There's always a human element to conflict, which is quite hard to predict. And then there are these kind of, I think what people now talk about in terms of black swan events like COVID, although we could argue that actually that was anticipated and predicted to quite a significant extent. We weren't ready for it. So in that case, you would need to think about how you could kind of anticipate how the system, and not only the national government systems, could build in contingencies to deal with a crisis of a certain magnitude, although it might be hard to anticipate what that is. And also, as we've seen recently with a a lot of the major crises, regional and global crises that we've experienced in the last decade or so. There are kind of interacting, connected factors, which mean that there are difficult to anticipate cascading impacts. So these things are quite hard to anticipate. So I think it is hard to plan for those things, but we need to get better at building a certain degree of contingency or redundancy into both national and international systems, so that we are ready for these kind of difficult to predict events, and not only in terms of having the material resources to deal with that, but also having thought through how we might cooperate with each other and to take decisions and to organise ourselves in advance of those things happening. So I think a variety of implications, both at the government and community level, but also some really big questions for the international system. If we're going to have these kind of large-scale, complex, difficult to predict crises which impact across multiple geographies simultaneously, what role does the international system need to play if we want it to be there to provide a sort of backup and global public good kind of function when for the magnitude of crises for which it's hard for individual governments to manage on their own.
Thanks, Lydia. Ric, I know that you have worked on historically setting up some social protection programs to respond to recurrent hazards and drought in East Africa. And I wonder if you could talk a little bit about how that came about in terms of how it was decided, okay, we have this recurrent hazard, this is what we need to do to address it, and then kind of what have been the things in place to sustain that response and hopefully prevent the impacts from those recurrent challenges.
Sure. So the clearest example of this is the Hunger Safety Net program in Kenya, which DAI managed. And I was the team leader in Kenya for nearly 5 years on this. And this it was essentially a government-led social protection cash transfer system, which had the vast majority of the population in the 4 northern counties very affected by recurrent droughts, and the major resource we had to work with was remote sense satellite data over the last 30 years, publicly available, which tracks the rainfall and condition of the pasture in those northern counties. So in an area that is predominantly a pastoral economy, and whether you're living in rural areas as a herder or a kind of a minor player, or you live in a peri-urban settlement, the general economy is affected by the drought cycle and terms of trade to do with pasture. So that under those conditions, we were able to look at that data, develop a probabilistic model and cost and set thresholds for releasing money through the cash transfer system, given a certain level of dryness or drought, until the brown turned to green and the pasture was restored, prices came down, livestock condition it improved, etc. So it relied on pre-registration of households, so a target that was replicable and objective, and with donors, in that case, as was DFID and the government of Kenya, to release money through that system given a certain set of circumstances. So that kind of simply put, that was the basis of that design. And so in calculating your probabilistic model, we were, the advantage of this was, that there was a drought cycle every 3 or 5 or 7 years. That it was inevitable, but the timing not predictable. So we had a very good statistical data set on that we could build on that.
Thanks so much, Rick. So I'm going to flag a question that's coming from Diksha Thapa, and I apologize if I'm mispronouncing anyone's name, but I'm going to ask it to you, Omer. So Rick, you talked about some sort of emerging models like climate tools, as well as using probability predictions. But Omer, what are effective risk mitigation approaches or innovations that you've seen within your work, besides the fact that we all agree we need longer term capacity and systems building?
I did. Am I unmuted? I just wanted to come back to the previous question and talk about, it's very important that we also have learning and adaptation. Learning and adaptation is essential when we want to strengthen our system. Learning and adaptation need to be promoted in a continuous process within pandemic, for instance, or between pandemic. So between the crisis or within the crisis, we need to have those learning adaptation, and that will help. So talking about the question that was put to me about effective risk mitigation approaches or innovation that I've seen working. So I'll just talk about the work on TDAP again, about what we did with the National Action Plan for Health Security, for example, in Cameroon, or what we did for the COVID vaccination example there. So what we see there is always that the government comes in, and we need to work for the government, but then the government always come in as a problem sometimes because they don't work easily with people and they don't just accept anything. So in our program, for instance, we saw that the government was challenging most of the things that we're doing in most of the countries that we're working in Africa. So one of the things that we try to do is adaptive management. So we have to build in our adaptive management to actually see how we could change from what the donor wanted and see also what the government wanted. So it was actually mitigating a lot of an approach to mitigate what the government was planning to do and what the funder, like that was FCDO, DFID, planned also to do. In our work now, so having to build that system, we constantly had to evolve our work plan. So the work planning was probably never stable. We always had to adapt, we all have to change. We needed to have a lot of capacity building, effort to do with the government themselves, the civil society, also with many people that lack a lot of personal skills, interpersonal skills, technical skills. So all those things are effective in risk mitigation, and those are some of the approaches. And in teaching people like communication, management, all those cultural things also that were very important in our work. Thank you.
Thanks. Lydia, did you want to add anything to that?
So I guess on the innovation point, so similar to Rick's point, it's a really exciting time for disaster risk financing, which has seen this sort of explosion in innovation that's been driven by the availability of data, and particularly satellite data that helps us to understand evolving risk and where and how it's likely to impact. So that's enabled the creation of new trigger-based financing instruments that's dramatically brought down the cost of providing insurance, because you no longer have to go and physically check that a shock has happened, you're able to just sign off on a pre-agreed payment on the basis of the satellite data, which may be verified in ground truth at ground level, but not always. So that's been a really exciting point of innovation for the DRF community, and I think there continues to be a lot of innovation now on the next generation of challenges associated with that, which is how you complement that with effective ground truthed information, which is probably limited by the quality of early warning systems at country level and the coverage of early warning systems. So I think there we see a real intersection of kind of the different pace at which science and technology and data is evolving at the global level, and then the difficulties in actually building and sustaining systems at country level. I don't know if you wanted me to pick up on the point about accountability.
Sure, yeah, that would be great.
It's a really so for me, this is a kind of an interesting question. It goes back to the question also about how do we empower local and national actors? And I was thinking about that when I saw that in the chat, and I thought, for me, there's kind of a semantic point there about, is it we, sort of, if I'm talking about we as international actors working for development organizations, I don't know if it's us that get to empower anyone. I think you negotiate power in an ongoing conversation, and international actors can help to support the enabling conditions and tools that you might have to be able to have that conversation. And I think in creating effective risk management and public services, it's a never-ending conversation between society and their governments. And we have in the UK, for example, we have had a National Health Service since 1948, and it is probably one of the top topics of discussion in every election, every day in the media. We have a very lively and active conversation between the population and the government about how we would like that public service to function. And so we never stop holding them to account on that. So I think that's, for me, accountability is about this kind of very active negotiation of power and holding power holders to account. And we have a role as international actors to hold ourselves to account against our own standards, and standards that are agreed internationally and with governments, and that there also can be a role for regulators in that. But we also have, I guess, a duty to try to support others to hold the system to account, but also a kind of a humility in acknowledging that we're probably not the ones that need to be having that conversation.
Thanks. So I'm going to turn to a question from Anna Cucurullo, who asks about mitigating corruption or fraud during a crisis. And she specifically highlights a security or food stability crisis. So Ric, I'm going to turn to you. But what do you see as the risks for fraud or corruption, and how much preparation can be done ahead of time, I'm assuming, to mitigate this and to prevent it as well?
Yeah, very, very complex question. It depends on what your starting point is and what the design is, whether you're working through government systems or it's more directly delivered by, through the UN system and through NGO implementing partners. It depends what context you're working in. We've mentioned accountability to affected populations. That's definitely a good. It's not a kind of financial management strategy, but it's definitely helps on fraud and accountability. The involvement of local voices and civil society in that feedback mechanism, conflict sensitivity analysis in of design is also very critical. That it's not when kind of in financial risk management it comes to mind, but it is a major factor when we're talking about the political economy aspects of with power and decision making. And then there's the kind of the direct financial risk management aspects of accountability kind of case management systems that allow people to raise concerns and an adequate follow-up and response mechanism, acknowledging that not everybody will want to raise concerns because of fear of retribution. So anonymity and sensitivity to minority groups and diversity in how your accountability systems actually work. So there's a huge range of kind of thought processes, approaches, and mechanisms that can all help to reduce the risk of fraud and corruption in aid delivery systems.
Thanks. I want to piggyback a little bit on what you just said and maybe turn it over to you, Omer. But in terms of thinking about raising concerns and corruption, and how do we make sure that we are ensuring that we understand the needs of the most vulnerable and are addressing those both in our preparation as well as our response to disasters. So if you could answer that, Omer. Oh, wait, and you're on mute. Oh, you got it. Okay.
Okay, thank you. I think one thing very important about corruption here, particularly in the countries that we work in Africa, was a big scandal, when the COVID funds, the first COVID funds were diverted to something else here, and the people started not even to trust anything from the government. And even with international partners like the WHO, I will tell you that it happened here that the first thing that the WHO did in the country was to buy a 4x4 vehicle, very big SUV for the COVID response. And then everybody thought that is corruption, that is not what people need. When people needed, like communication, public messages, medicine, beds, ventilators, they were buying all those things. So what we saw here during the crisis also was that most of those people that we call the vulnerable people, like the different community, the poor, the women, the young children, handicaps, were not a lot involved or not a lot rich during the crisis. So the thing is that the money that comes in, flows in, is usually used to make sure that there is a lot of publicity around what the government does. So you will see spot on the TV that are bought, you'll see a lot of things that are done so that they portray that the government is working. But they had to reach people, they displaced people, like in several displaced camps in the community here in Cameroon. There was no public message reaching them. The people were in a war zone too, where there was no way to reach them. So I think most of those people, actually, that's where the money gets diverted from. They had to reach people, to reach those people who are in the civil, in the urban centers, where TV can go there easily and get them. So the fraud, the corruption there is really heavily in the government system itself. And that's why exactly that they don't want the civil society to be there, because they know that their role will be to check in where that support goes to. And I think it's not only the government, but I think even the implementers. Some of the implementing partners sometimes also do not do what we call JESI, gender equity, social inclusion. Most of them do not incorporate that in the core of their project. So when the program comes in, we need to make sure that it has all JESI elements in it. So because it's lacking in most of in the core or during the setup of the program, it's not done on the ground. So I think one of the ways to mitigate that, and one of the ways to that, to make sure that we have gender equity, social inclusion in all the programs. And that would not only help to reach all those people, but also we know that the money that is invested in the country doesn't only go to places where there will only be publicity or in the urban area. Over.
Thanks. Lydia, I'm going to turn back over to you to sort of piggyback on that And how are Jesse considerations incorporated into disaster financing?
I think not very well is the short answer to that.
Thank you for
Often,
your honesty. I feel like we all need to be more honest
I
about
think
it.
often disaster risk financing instruments are negotiated at the sovereign level, and they may not have a great deal of detail about how the money is actually going to be spent after it's received by governments. And that's considered to be at the discretion of governments. And sometimes that might be fine because actually the money might be for repairing a bridge or something which, some infrastructure that might not necessarily need that level of detailed consideration. But where we're talking about payments being provided to individuals or services being provided to individuals, where it absolutely does matter who is targeted and how they receive that assistance, that ought to be part of the detailed planning that's part of good disaster risk financing. And in some cases, and this is one of the big challenges that we face now with disaster risk financing, it's relatively easy to design a financing instrument. It's much, much harder to make that work effectively and articulate with the government systems that are going to actually deliver that funding to the point of reaching the hands of people that need it. So a lot of the work around targeting and inclusion is actually done by different parts of the government. So we need to be working much more effectively to think about the whole transaction chain, from the design of the and of money going into the system, working its way through the system, so through the government's public financial management systems, and then how it works its way through the delivery systems, such as a social protection system or a public health system, to have kind of the different components of the whole transaction chain speaking to each other and making sure that they're aligned and being held accountable across that chain to make sure that assistance is really working in the interests of the people who are most affected.
Thanks. Rick, I'm going to ask you to piggyback on that and sort of how do you bring those voices up and incorporate those Jesse considerations in the social protection aspects of disaster response. And then also, how might you take something like a bridge in terms of, that seems like it might not have Jesse considerations, but make it open to potentially female vendors, or make the workforce place of building the bridge safe for women to be workers? And like, are there ways to incorporate Jesse considerations across the board?
Well, I think you've already answered the last part of your question, Kirsten. I think one of the headwinds in trying to have pre-agreed disaster risk plans in place is that, as we've talked a lot about already, accountability needs to be clear. Responsibilities for actions in the event of a disaster need to be predefined, and that, by definition, reduces the amount of discretion and ad hoc decision making at the time of a disaster. And so, authorities, people in power, don't have less ability to operate and reward or deny certain populations or population groups with an aid response, and that's, if you remove the political, it's from a political economy issue, that reduces government and other kind of authorities' participation in that form of agreement. So, again, all the more important to get all this stuff put in place in between disaster events occurring, to ensure that, to invest in civil society, to invest in some of the more mundane backbone systems of a disaster response. We talked about how challenging it is to prepare for black swan events like COVID. In the social protection response to COVID, it was clear in a number of places that the response was thwarted by fundamental things like no legal agreements between ministries across government, or no data sharing mechanisms between UN agencies, and these are all things that needed, that really should have and could have been in place in preparation for any sort of disaster risk, whether they're health related or natural hazards or whatever. So it's kind of going back to the basics of good program quality. Your gender and inclusion analysis and accountability is absolutely fundamental to that. Whether this is a long-term developmental approach or in preparation for a sudden disaster event.
Okay, I'm recognizing that we've only got 14 minutes left, so this might be our last question that I asked to each of you, or we might have some more time. But given the theme that's been in our conversation, as well as the chat around accountability, and the theme of the SID conference this year of power shift, I'm wondering if I can ask each of you who you think has the power in terms of disaster preparation and response, and who you think needs to have that power, and what we can do to make that happen. So I'll start with you, Omer.
Thank you. I think the first thing I would say is that we need to know the critical elements, and when you see all those elements, the short answer is that the government and the civil society. But in general, I would say it's a world government approach, a world of population approach to having that effective crisis management. So we need, for instance, to have service delivery when there's a crisis. We need to have a health workforce when there's a crisis. We need to have information communication when there's a crisis. We need to have medical products. We need to have technology. We need to have vaccine. We need to have them deliver. We need finance, and all those lie with the government. We need also leadership and governance again, and all this lie with the government. So what I see is that we need to start shifting power, and then I will talk about two levels of power shifting power from the government to the civil society. I think with the example of COVID that I gave, a lot of power is shifted to the civil society, where society become, part of their own answer, where they are more engaged. I think we start seeing a lot of more trust in the response and in the preparation and even the recovery of what we are seeing. So if power needs to be shifted, we need to be shifted from the government that has all the power now to the civil society. And one way of doing that is actually what we call localization, localized global health, localized, health. And that is what is trying to happen at this time in terms of localizing fitness, localizing responsiveness, localizing ability to cope, localizing recovery, and even localizing the learning adaptation. That will shift all those power to the civil society. And then in saying that, when we talk about moving from the government, shifting that, we're talking about civil society again. We're talking also again about the decentralization process. So we need to start thinking about empowering local decision making in the health system management, while we still ensure central coordination. So the central coordination must be there, but then the local decision making will continue to rely there. There will be no simple, answer to that. It will depend on the existing political system, and there will be some function that can be best decentralized, and some of the functions that cannot be decentralized or can be decentralized on a case-by-case basis. So the power needs to be shifted in a nutshell from the government to the civil society. But then we also think about not only localization, but also ensuring decentralization on a case-by-case basis. Over.
Thanks. I think we have exactly 30 seconds left. So apologies that I'm not going to ask Lydia and Ric to answer that question, but I do think that Omer raised some great points about shifting the power to a more local level and leveraging those localization and decentralized structures. I just want to say thanks to everyone who participated in the chat and came to today. This was an exciting opportunity for us to have this conversation and learn from each other, as well as hear some of your perspectives and questions. So thank you so much.
Thank you.